If you're a pet owner, hearing a cancer diagnosis is just about the scariest thing imaginable. And it's even tougher when it's an aggressive kind, one that just seems to fight back against every treatment. So today, we're going to dive into a really new way of thinking, a multi-layered approach to fighting one of these really, really tough cancers.
So, how does this all start? Well, it's usually something that looks really small. Maybe you spot a little sore on your dog or cat's face, or in their mouth. You try to take care of it, but it just won't heal. In fact, it's getting worse. It's almost like something is literally eating away at the tissue. It's a scary sign, and it points to something very specific going on under the surface.
And this description, wow, it just hits you. This is what's actually happening. It's not just a tumor growing, it's a full-on invasion. The cancer is actively dissolving the healthy tissue all around it. I mean, that's a terrifying thought, right? And it explains exactly why this disease is so destructive. So what is this thing we're up against? It's called squamous cell carcinoma, or SCC for short. And to have any chance of fighting it, you first have to understand its game plan, what the source material calls its destructive instincts. So what is SCC really? Well, it's a cancer that doesn't play by the rules. It doesn't just grow in a nice, neat little ball. No, it infiltrates and it destroys, breaking down the very walls between cells. And that's exactly why surgery is so tough, especially in tricky areas like the jaw. How can you be sure you got every last invasive cell? It's incredibly difficult. So think of it like this. Cancer has a three-step game plan. First, it literally melts tissue with special substances. Second, it busts through boundaries. It refuses to stay put. And third, its ultimate mission is to spread out and set up new camps elsewhere in the body. It's a really formidable opponent. Okay, so if a single attack like surgery doesn't always work, what's the alternative? Well, the new thinking is to completely shift the strategy. You move away from that one-dimensional fight, and you build a multi-layered defense system, one that's designed to counter every move the cancer makes. Yeah, we're not talking about some single miracle drug here. Nope. This is what's called a system therapy. And the whole idea is to hit the cancer from 5 different directions all at once, blocking the very survival tactics it needs to grow. And that's really the heart of it, right? Instead of just trying to poison the cancer cell, this strategy is all about dismantling its entire support system. By figuring out its 5 main survival tricks, you can create a 5-part plan to shut every single one of them down. Okay, so how does this actually work? Let's get into the nuts and bolts. We're going to walk through each of the 5 tactics that make up this defense system. Think of it like a super coordinated 5-pronged attack. All right, tactic number 1. Remember how the cancer's first move is to melt healthy tissue? Well, this is the counter move. The idea here is to build up the body's own defenses. This therapy helps stop those dissolving enzymes the cancer releases. It's basically like building a defensive wall so the healthy cells can hold their ground and resist that invasion. Okay, on to tactic number 2. This one targets the cancer's environment because, it doesn't exist in a bubble. These aggressive cancers, they just love inflammation. It's like pouring gasoline on a fire. It's fuel for them. So this tactic is all about putting that fire out. It works to suppress the inflammation, turn off that fiery signal, and just cool the whole area down, making it a terrible place for the tumor to grow. All right, let's talk about number 3. This one goes after the cancer's massive appetite. Think about cancer cells. They are just so hungry. They need a ridiculous amount of energy to grow and divide. So what do? You cut off the lunch line. This tactic blocks the pathways that deliver energy, essentially starving the cancer cells and forcing them into a much weaker, dormant state. Okay, tactic number 4. This one is designed to jam the cancer's production line right at the source. A cancer's main job, its whole mission, is just to make copies of itself over and over. It's like a factory gone haywire. So this tactic is brilliant. It basically introduces an error into that system. It's like throwing a wrench in the gears to stop the whole production line. And finally, we have number 5. And this one tackles what is, for sure, the most dangerous part of any aggressive cancer. And that's its ability to spread, to metastasize. So this last tactic creates a blockade. It aims to cut off the escape routes, like blood vessels, that cancer cells use to travel. You isolate the tumor and stop it from setting up shop in other parts of the body. So when you look at the whole system, you can really see the genius of it.
It's not one big hammer. It's a series of smart, interlocking moves. You reinforce, you cool, you starve, you block, and you contain, all at the same time. You're dismantling the cancer's entire operation.
So that brings us to the big question. Why does this holistic approach, this three-dimensional defense, even matter? What's the philosophy here? And this just lays it out so clearly. On one side, you've got a single attack. It's a flat, one-dimensional plan against an enemy that operates in 3 dimensions. But on the other, you have this dynamic, holistic defense. All 5 pieces work together like interlocking gears to create something way more powerful and adaptable. But, at the end of the day, here's what it's really all about. It's not just about what a scan looks like. The real goal is to defend the pet's quality of life. This whole system is designed to preserve those simple, precious things. The ability to eat without pain, to breathe easy, to just be comfortable. That is the real win. And that leaves us with a really big question to think about. This approach for our pets, it really makes you wonder about medicine in general. As we face these super complex, aggressive diseases, maybe, just maybe, the future isn't about finding one single magic bullet. Maybe it's about building these intelligent, multi-layered systems designed to bring the whole body back into balance.